Hello? Okay na? Ready na ba ang lahat? Okay. Pwede na ako mag-start, Sir Marco? Alright. Naka 10 minutes sa sobra pa nga tayo ng 10 minutes eh. Kayo talaga ha. Ganun ako kabilis kumain class. Anyways, since well-rested na ako, may energy na ulit ako. Hello everybody. Ito naman ngayon is for clinical hematology. You'll receive a copy of this one at the end of the lecture. So let's start with question number 1. Case presentation naman tayo. As always, pag ako ang gumawa ng exam, hindi na nawawala. A 3-year-old patient came to the AR with signs and symptoms congruent with the diagnosis of anemia. We don't know what type of anemia yet. CBC results indicate that the patient has microcytic hypochromic anemia. So we know now, based on what is provided, what parameters should the medical laboratory scientists look for before concluding that microcytic hypochromic anemia is indeed the correct diagnosis. Peripheral blood smear with Rouleau formation, X. Lower than normal hemoglobin, 4 grams per deciliter, yes. MCB of greater than 65 femtoliters. Ano nga ba ang normal value? 85 to 100, diba? So it's yes again. Presence of acanthocytes in the blood smear. Not really sure why. So the correct answer, class, how many people were able to answer that one? Let's see. Saan na ba yun? Sinend sa akin Sir Marco yun eh. Saan na yun? Very good. Nakakatuwa. Proud na proud talaga ako sa ano na to. Mga students na to, Sir Marco. 58% were able to answer that one correctly. I love it. I love it. Imaginein mo, Sir Marco, ang hirap i-type niya na. Ang haba niyan. In fairness, tuwang-tuwa talaga ako sa kanila class. Alright, next, let's continue. Related to the previous question, syempre, related doon, which of the following is not associated to the patient's condition? Remember, hinighlight ko kanina dito, microcytic hypochromic anemia. Yan na yarn. Okay? Yan na yarn. You have supporting data here. Items 1 and 2 and 3. So, iron deficiency anemia, is it microcytic hypochromic anemia? Yes. Sickle cell disease, kakasabi ko lang kanina doon sa may blood transfusion camerot natin, yes. Sideroblastic anemia, yes. Allogenic hemolytic transfusion reaction, inechos ko lang kayo dyan, class. Class, inechos ko lang kayo dyan. Pinahaba ko lang. Pwede ko namang sabihin transfusion reaction. Pero gusto ko lang kayong echosin. Kaya nilagay ko, ba't carrier? Ba't carrier? Allogenic. Kaya inechos ko lang kayo dyan, class. Ang tamang sagot dyan is letter B. Okay? Letter B. Let's see how many people were able to answer that one correctly. Okay, so hindi natin masyadong pag-iinitan yan. Next tayo. Supravital staining in hematology labs is best used in demonstrating what cells? Mast cells? X. Reticulocytes? Yes. Si blue histiocytosis, kemerot ko lang yan. Nakita ko lang ito sa libro. Dinagdag ko dyan. Inechos ko lang kayo. Hairy cell leukemia, ano ang gagamitin natin dyan? TRAP. Tartrate resistant acid phosphatase. Okay? Yun ang gagamitin niya. Mast cells, anything that you can use but on tissues. What are mast cells again? Kakasabi ko lang kanina sa sa immunology natin. That is tissue basophils. Alright? Which of the following would be expected to be elevated in cases of trichinosis? You need to know, you have to have prior understanding of what is trichinosis. Trichinosis is a parasitic infection. Therefore, eosinophils would be expected to be high. Okay, actually the highest, if you look at the literature, the highest known case of eosinophilia was obtained from a patient with Trichinella spiralis infection, fulminant Trichinella spiralis. So, lagyan natin ng controller. This one. So, mabilis lang tayo ngayong class, no? Ayan, ito yung isa sa mga ano ko. Diba kailangan galagay ko si V. Asinas. Mali ang spelling ng ano ko, alam ko. Para hindi ako pwedeng ihabla ng estudyanteng ito. Okay? Okay? Alright, so V. Asinas, RMT, diba, has been working in the clinical laboratory at the heart of Metro Manila. His work includes preparing slides for leukemia staging for the clinical pathology residents and consultants. Today, one slide was sent back to Mr. Asinas For a repeat smear and staining with the following comment written, smudge cells present. Please redo the slides. Given the following comment on the report, what is the most likely reason why the slide was sent back and not reported? Taray, di ba? Mali ang ano. Mali ang punctuation mark. Nangangati ako pag nakakakita ako ng mali sa mga tinype ko eh. Okay? Alright. So, first one. Tingnan muna natin kung gaano kadami ang mga sumagot ng tama. Sir Marco, nakakatuwa. Ang daming nakasagot. Natutuwa ako. Pero doon sa follow-up questions, hindi ko nagustuhan yung follow-up. So, ang daming nakasagot. Artifactual. Diba? Kino-confirm ng mga doktor kung artifactual. Malay ba natin yung tao na nag-work before kay V. Asinas RMT. And yes, kiniklaim ko na magiging RMT ang ang junaknak ko. Okay? Masyado lang malakas, forceful smearing ang ginawa niya. Kaya siya nag-produce ng smudge cells. So doctors would question, maybe it's artifactual. Let's try it with another person like V. Asinas RMT, 'di ba? So tama kayo, class. Tama tong niyo. The doctors are not trained well on the minor intricacies of smudge cell morphology and have requested to see if it comes out differently. Charing lang 'yan, okay? Char ko lang 'yan. Mr. Asinas and the residents have a strained relationship. The doctors are giving him a hard time. Walang ganun sa laboratory. Professional tayo, class, ha? The doctors broke the slide and are only asking for another one because they're afraid of getting reprimanded by the chief resident of the iba. Kaya man pala madaming nakasagot, Sir Marco. Obvious naman na mali yung sagot na iba. Okay, dito tayo nagkanda loka-loka. Ano ba tong na to? Tuloy-tuloy pa din ba ako? Okay. Please send a smiley face kung naririnig nyo pa rin ako. Please send a smile. Heartman yan, Jeneline. Nakakaloka ka, Jeneline eh. Heartman yan. Smiley face ang hinahanap ko. Ikaw talaga, Jeneline. Pero thank you, Jeneline. Alright. Dito tayo nagkanda loka-loka. Kasi naging sumabog bigla ang distribution ng mga may tamang sagot at maling sagot. Because of this one. Number 6. The case related above, non-artifactual, related to the case above, non-artifactual smudge cells could be an indication of CLL class. Okay, CLL. Ano ba yung mga yan, friend? Ano ba yung mga yan? CLL is chronic lymphocytic leukemia, acute lymphocytic leukemia, acute myeloid leukemia, and ano yung MMM na yan? Marvi Moran, Di Maano? Hindi. Ano yan, class? That is myelofibrosis with myeloid metaplasia. Now, which of the following stains is a supravital stain? Sinagot ko na yan kanina, new methylene blue. Okay? Yun lang yung pwede nyo gamitin. Or malachite green. You could use malachite green para for malachite green ba? Yeah, malachite green for supravital staining. But anyways, let's move on to the next one kasi ang dami naman nakatama na sagot sa new methylene blue. Hindi wala silang chance para makapagkopyahan, Sir Marco, no? Yung may mga ano ba sila? May mga suot ba sila na special hats para hindi sila makapagkopyahan?
Wala naman, pero kung nagkopyahan sila, I guess that would make sense kasi ang daming bumagsak eh.
Hindi ko gusto ang Hema. Hindi ko gusto ang performance sa Hema. Naloloka ako. Number 9. Medyo
Sir, nawala yung presentation mo.
Nawala.
Nawala, sir.
Nawala? Hoy, ano yan? Tama ba yan? Charit. Tingnan natin. Ulitin natin. Stop presenting. Present this tab. Ayan. Okay na. Allow. Ayan na ulit. Carry boom na ha. Okay, very good. Okay, so, let's go to the next question. Number 8 tayo. Which of the following is false? Ayan na, kinapitalize ko na. Kasi medyo naawa ako dun sa unang exam ko eh. Turns out dito pala kayo nagkakamali, no? Ano to? Presence of smudge cells are seen in the smears. Prognostic markers are important in determining the efficacy of chemotherapy. True. Incidence in adults is quite uncommon. Actually, baliktad. Kasi kapag sinabi mong chronic, di ba mga matatanda, adults usually ang onset. Acute, equal to childhood onset. Chronic, usually adult onset. Okay? Kaya para hindi maloka yung mga students. Okay? Which of the following statements are true? Para walang takas. Statements are true regarding hemolytic anemias. Number 1. MCB of patients are within normal range in most cases. Check. There is no effect in the levels of unconjugated bilirubin. Hoy, ano yan? Hemolytic anemia nga, di ba? Di ba? So, check. Conjugated kasi yung pagka liver disease, 'di ba? So tama tayo diyan. Check. Okay? Direct Coombs test is an important test to determine the cause. Check. Polychromatophilic normoblast is elevated. Is that a check? Yes, check. So ano ang mali? Ito ang mali. Okay? So that's why the correct answer is this one. Okay? Yan ang naiiba. Okay? Kailangan natin ng may effect sa conjugated levels, di ba? Unconjugated levels. Okay? Bakit? Ano ba nangyayari sa blood? Kailangan pa ba natin i-expect? Tingnan muna natin kung ano. Tingnan muna natin kung mataas ba ang percentage ng nakatama. Mataas naman, 50%, so hindi natin kailangan mag-delve deep. But for your information, why this one is incorrect, why this one is the one, why this one is the incorrect, why this one is the one that's excluded, it's because there is an effect. Okay? It should be elevated. Okay? Because it's a hemolytic anemia. Alright? What is the importance of performing Coombs test in the diagnosis of hemolytic anemias? It helps determine the stability of RBCs in an acidic environment. This is known as sugar water test. Okay? Walang kinalaman yan. Next. Hemoglobin, the reagents deprive the hemoglobin cells of oxygen by thereby allowing hemoglobin to polymerize. Nope. That is for sickle cell screen. Kasi madaming nagkamali dito, Sir Marco, kaya isa-isahin natin sila para wala silang takas sa akin. Okay? Okay? It allows the spectrophotometric measurements of hemoglobin levels of the sample, hemoglobin levels of the sample after lysis. That is the correct answer, if I'm not mistaken. No. Sorry. We're talking about Coombs test pala. So no, that is after spectrophotometric measurements of that is hemoglobin electrophoresis. Okay, this one is antibodies present on the surface. That is that. Okay. Bakit that? Hindi IAT. Bakit hindi indirect immunoglobulin? Kasi red cell surface. So, ibig sabihin, present na siya. Okay? Nandun na siya sa loob. Nasa ano na siya. Hindi mo siya i-attach. Pag i-attach mo siya, that is AIT. But that's not what we're talking about here. Next, which cell populations are elevated in patients with Fanconi anemia? Are expected to be elevated? Fanconi anemia nga di ba? Diba? Fanconi anemia pero may elevation. Di ang sagot neither. Tingnan natin kung sino ang mga nakasagot. Kung marami ang nakasagot pala. Ang tama. 11. Hindi ako proud sa inyo, class, ha? Hindi ako proud. Dahil dito. 16 people lang ang 16%, 16.9% lang ang tama. And then the rest were incorrect. Class, pag sinabing anemia, mababa nga di ba? So, ibig sabihin, ine-etchos lang kayo. Kaya sinabing neither, di ba? Neither RBCs nor WBCs. Nadadali ko sila sa technicality, no, Sir Marco? Yung grammatical technicality. Siguro kailangan natin ng medyo direct ang approach. Or should I make more of exams like that, Sir Marco? Send a heart pag Send a heart, Sir Marco, pag gagawa pa ako ng more exams na ganon. Anyways, let's continue while we're discussing. Anyways, let's talk about FAB classification of AML that won't test positive with myeloperoxidase. There's only one, that is M7. Okay? The rest of them will test positive with myeloperoxidase. Bakit? Ano ba ang M7? Ano bang ibig sabihin? Ano ba ang term natin pag M7? What is M7? M7 is, ano ba siya? Diguglemus syndrome ba siya? M7. M7 in, sorry, mag-reply lang. M7 in anemia, ay, leukemia. M7 in leukemia is known as acute megaloblastic, sorry. Acute megaloblastic leukemia. Okay? So, megaloblast ang affected. Megaloblasts, and their end products are platelets. So they don't have the myeloperoxidase they won't have the myeloperoxidase um, molecule or enzyme because class they won't react with the myeloperoxidase enzymes because these things they don't have granules. Okay, not platelets. Okay, next. Burkitt cells are characterized by iron deposits stained with pearl's Prussian blue, large vacuoles present in the lymphoblasts, presence of our rods in the cytoplasm, stains well with TRAP. I've mentioned earlier this is for hairy cell leukemia. This is for our rods. Our rods is an indication of something else. Prussian blue, Pearl's Prussian blue is sideroblastic anemia or siderocytosis. And the only thing that's left is this one. Okay? So this is ALL. Okay? Or Burkitt cells. ALL what? ALL 1 under the FAB classification. Okay? Case presentation. A 7-year-old patient. Tingnan muna natin kung gaano kadami ang sumagot ng tama sa Burkitt's lymphoma. Very good. I'm so proud of you, class talaga. I'm so happy. 60% of people were able to answer that one correctly. Number 13 yun. Yeah. 60% of people were able to answer that one correctly. Number 14 is a case analysis. Medyo magulo ang distribution ng Actually, 16 lang na tao ang nakasagot nito. And hats off to you guys if you answered this one correctly. A 7-year-old patient was admitted to the pediatric intensive care unit. Hemoglobin RBC count are within the normal range. An abnormal WBC count was noted, 65,000 units per microliters. Microliters, sorry. Blood smear shows large numbers of lymphocytes and lymphocytic precursors. Lymphoblasts are characterized by small, homogeneous, diverse morphology. Flow cytometry results were as follows. Result to follow. Obviously, hindi din. Siyempre, kapag mga case analysis ko, laging to follow yung mga diagnostic markers. Diba? Based on the initial result, what would be the most likely diagnosis of the patient? Obviously, if this is a 7-year-old female, you would have to remove CLL. Remove CLL already. Okay? The other ones are very easy to identify. Burkitt cells, this is a characteristic of a Burkitt cell. Okay? Homogeneously diverse morphology. The other two, they would have normal sized blast cells with mixed morphologies. Okay? Both of these two. Mixed morphologies. So the only thing that indicated that this one is FABL is the homogeneous mixture or the homogeneously diverse morphology. Okay? If it wasn't for that one, we would have said it was FABL2 or L3. Okay? Now, coagulation disorder naman tayo. Coagulation disorders are the most common complication of this AML classification. This is M3, otherwise known as what? Otherwise known as AML3. M3 is otherwise known as AML3. Ano nga ba? Wala yung listahan ko. AML3. Leukemia. AML3 is Balikan natin pag naalala ko. Balik tayo dito. Punta tayo dito. Nawala yung listahan ko eh. Which of the following is considered as a limitation of sickle cell screen, also known as the sickle cell solubility test? Let's see how many people made the correct answer, selected the correct answer. Number 16. Balikan natin to mamaya. Nawala yung listahan ko eh. Number 16. A. You cannot distinguish. The correct answer is letter A. Cannot distinguish between trait and disease. So a lot of people were able to answer that one correctly. Why? How do we? Why? What's the reason? It's only a screening test, and to confirm, we use electrophoresis or HB-elec. Okay? It cannot distinguish. It cannot detect HBSC. You can if you already see it, but you can see hemoglobin S crystals. Okay, it requires a large amount of sample to perform. Actually, it only needs a drop of blood. Reagent stability is of great concern. No, it's not, because of the acid is mixed usually in the kits for sickle cell solubility test. They are separated. There's a 1 week stability test when you mix the reagents, but it can last a long time. So that's a big no-no. So the only thing you can see is this one, because it can be confirmed by hemoglobin electrophoresis. Okay? Now, which of the following stains is a monochrome stain for iron precipitate? Paulit-ulit ako, no? Ini-etchos ko kayo. Alright? A monochrome stain for iron precipitate, hindi siya methylene blue. It's Pearl's Prussian blue naman. Okay? Iron deposit ang tine-check natin, ha? Okay? Pearl's Prussian blue. Okay. Now, what is the chemical? What chemical is the most commonly used fixative for blood smears and bone marrow aspirates? It is methanol. Okay, it's methanol. HICN can measure a wide variety of hemoglobin variants except for HICN is a methodology using also known as hemoglobin, or your methemoglobin, cyan methemoglobin, by the way. This is known as HICN, is cyan methemoglobin determination. Cyan methemoglobin determination. Except for sulfhemoglobin. Okay? Can detect everything except for sulfhemoglobin. These are hemoglobin variants. Okay? It can also detect carbaminohemoglobin, but I didn't list it there because you won't have a wrong answer. Which of the following analytes is useful? Sorry, baba natin. Mas makita ninyo. Which of the following analytes would be useful in determining the case of macrocytic anemias? Serum iron, obviously not. Serum LDH, kind of, but not really. Plasma ammonia, no. The most important one is homocysteine. Okay? Macrocytic anemias. Homocysteine. Okay? You can use the methylmalonic acid method or the MM method. But serum homocysteine is enough. Using MM method, you could actually measure homocysteine by dissociating homocysteine with methylmalonic acid. But at the very least, what I'm asking you guys is the homocysteine test. Okay? Or the serum homocysteine analyte. Let's see how many people were able to answer that. Not a lot of people. Ayaw nang sinagot ng lahat. Sir Marco, bubula ang bunganga ako talaga. Macrocytic anemia yon. Hoy, macrocytic anemias tayo. Ano ba ang dinetest natin pag macrocytic anemias? Ano ba? Vitamin B12. Vitamin B12. Macrocytic anemias, the tests that we look for is vitamin B12, folate, and MM or methylmalonic acid or HMO, homocysteine. Okay? Yun yung mga mini-measure nila. Okay? Clear ba tayo, class? Sana nakaka-follow pa. Tapos naman na ang exam, pero baka may magre-repeat ng exam. So, that's the reason why we're doing the rationale for you guys. All right? So let's talk about number 21. Let's see how many people were able to answer number 21. Very good. Proud ako sa inyo kasi walang nagsagot ng madami pa rin pala nagsagot. Anyways, correct answer is letter C. Let's read the test first. Let's see the question first. What is the test that is previously performed on patients with PCH? So PCH is paroxysmal cold hemoglobinuria. Okay? Which of the following was previously performed on this test? So obviously this is Bence-Jones proteinuria is not really involved in that one, but that's for multiple myeloma. Okay. Or MM. Kumpletuhin nga natin, baka malito sila. Alright, and the demonstration of osmotic fragility. Osmotic fragility test is used for hereditary spherocytosis. Okay, the Rec-Coombs test to demonstrate in vivo sensitization of RBC specifically performed at room temperature is the test of choice. So this is for cold agglutinin test. This is actually a cold agglutinin screen. Okay. Next, which of the following number 22? Tingnan na natin how many people were able to answer number 22. A lot of people. Yay, I'm so proud.
Sir,
Yes. Echo, echo, echo.
pwedeng papaspas.
Oo, papaspasan natin. Doon tayo sa mga ano.
Minutes na lang.
Oo nga eh, nasa 22 pa lang ako. Nagmamadali nga ako para ako si Lolit Solis, Sir Marco. Diyos ko, para ako nagpapasalamat sa mga sponsors. Sandali lang, ito na.
Ito yung mga inters, so itsura nila.
Mamaya picturean mo, Sir Marco, tapos send mo sa akin. Okay?
Picture ako na lang daw.
Oo. Which of the following is a blood pressure suggested of monoclonal gammopathy? Monoclonal gammopathy. Peripheral blood may suggest of monoclonal gammopathy or macroglobulinemia. So macroglobulinemia, meron tayong RALU formation. Okay? Kasi this abnormal serum proteins. So marami din nagkamali diyan. Let's go to our case presentation number 22. Madaming tama sa case presentation. Correct answer for number 22 is letter A. So I think everybody knows the problem with that one is the isoniazid blocks the B6 in the synthesis. Okay? Number 22. Number 23. Related to number 22, syempre anong anemia? Ang tatanong ko diyan, it's sideroblastic anemia. So madami nagkamali. Kasi ang sagot ng mga tao is number 23, letter A, iron deficiency anemia daw. Nope. That's sideroblastic anemia. Okay? Alright. Bakit ano nangyayari? Kasi ang binablock nagpo-produce ang patient ng nabablock yung iron or heme synthesis. Okay, so sideroblastic anemia ang cause. Which of the following have been known to cause hemolytic disease? No, not hemolytic disease. This is hemolytic uremic syndrome. Hemolytic uremic syndrome. Hemolytic uremic syndrome, E. coli lang siya. E. coli. Kasi marami ang nagkamali ata dyan. 24, ang mga pinili ng mga majority of the people selected H. pylori. I don't know why you guys chose H. pylori, although uremia could be or ulcers could be caused by urea. Hemolytic uremic syndrome is for H. pylori. For E. coli. Specifically, enterohemorrhagic E. coli. Heck. Okay? Thrombocytopenia and lymphocytosis with low RBC count is characteristic of what stage of Rye testing? So, for Rye testing of CLL, or Rye staging, that's the last one that I have in my leukemia manual. That is for number 4. That is characterized by number 4. Okay? Thrombocytopenia does not occur until stage 4. Okay? There are only 4 stages in Rye staging. Okay? The 4th one where bleeding disorder occurs is on the 4th stage of the disease. Okay? Other ones are just presence of smudge cells, presence of minor weakness and fever, blah blah blah. But on stage 4, there's bleeding disorders na. Okay? What is tested in the urine of patients with multiple myeloma? Yan na naman tayo, multiple myeloma. Master na siguro ninyong lahat ang multiple myeloma kung hindi pa din kayo kung nakasurvive kayo dito sa class ko na to. And a lot of people answered correctly, Benz-Jones protein. Yeah, let's go. Very good. Next, what is the main goal of doing a peripheral blood smear? Numbers. Tinanong ko yan sa inyo. Hopefully, lahat kayo nakasagot. Very good. I'm so proud, Sir Marco. Ang daming sumagot ng tama. Number 2, letter D. Yes, very good. Mali. May bakit yan ang sinelect ko? 27 pala tayo. Letter A. Ayan. To study the morphology and finding. Hindi tayo nagko-correlate. Pag nag-request ang doktor ng peripheral blood smear, hindi siya nagko-correlate ng automated results. Okay? Gusto niyang malaman kung ano ang meron sa pasyente. Tayo ang gumagawa ng correlation ng automated CBC findings. Hindi ang mga doktor. Atin to. Medtechs. Okay? MTs ang gumagawa nito. Okay? The main goal of peripheral blood smears is to study the findings. Okay? Sickle cell screen tests for anemic patients should be done using EDTA blood, syempre. Pero anong klase? Centrifuge dapat. Let's see how many people were able to answer. Bakit kailangan i-centrifuge, sir? Number 28. Let's see. Bakit kailangan i-centrifuge, sir? Kasi anemic nga sila eh. So, ibig sabihin, pag ginawa mo, magkakaroon ka ng false negative results, di ba? Anemic nga sila eh, di ba? Anemic patients. Okay? Anemic sila. So, this is a pre-analytic consideration ha. You can see that in your books, RODAC. Okay? That's a pre-analytic consideration. Okay? Next. When a clotted sample is analyzed in an automated analyzer, which of the following parameters would be most affected? Clotted samples tayo. Clotted samples. Is it WBC? Is it RDW? Let's see how many people will be... Marami sa inyo nag-intern, so obviously marami makakasagot. Platelet counts ang tamang sagot. Very good. What would be the expected result? Is it falsely increased, falsely decreased, false positive, false negative? Neither of these would be the correct answer. The correct answer is number 30. For number 30, the correct answer is letter B. It's falsely decreased. Bakit? It will be counted as other WBC or as an RBC or WBC kasi nga nag-clump together sila, 'di ba? Nagdikit-dikit sila. Okay? Or na-consume sila, nagdikit-dikit sila. Okay? Next. What would you being the technologist what would you do as a technologist? Let's see kung maraming nakasagot ng tama. Very good. Proud na proud talaga ako sa class na to. Kasi hindi nila i-rerun ng sample. Ang gagawin nila is i-dilute nila. Charet lang. Hindi nila i-dilute. Ang gagawin daw nila is recollect a new sample. Natutuwa ako sa class na to, Sir Marco. Okay? Which of the following causes platelet satellitism? Mali ang spelling ko ng satellitism. EDTA. Okay? EDTA causes platelet satellitosis. How many people were able to answer that one correctly? Number 32. Okay, so no need for further this one. Number 33. Marami rin ang tamang sagot dito. A patient was admitted to the hospital for muscle pain, rigidity in different parts of her body. History reveals that she's been a traveling ballerina who was on tour in Southeast Asia and South America for the past year. Her meals mainly consist of pork and pork products. Her case is immediately diagnosed when the X-ray showed multiple opacities resembling a muscular parasite typical of Trichinella spiralis. Which of the following blood cells would be extremely elevated in this case? This is a case of eosinophilia. Okay? Marami na nakatamang sagot. Let's move on. Okay? Which of the following immunoglobulin classes is found on the surface of B cells? I think ito yung mali ang sagot ng mga tao kanina. Pero bakit dito tama naman sila lahat? Naguguluhan ako sa inyo. Okay talaga. Dalawa ang nakakabit kay B cells sa IgD and IgM. Hindi lang IgD. Okay? What is the name for the basophils in tissues? Kanina ko pa yan sinabi, mast cells. And I think everybody was able to answer that one correctly. Okay? No need for further explanation. Which of the following organs contain macrophages that kill senescent cells. Favorite ni Patrick? Kaya feeling ko madami nakasagot ng tama. Tama sila. Okay. A lot of people answered the spleen. Very good, very good, very good. Tuwang-tuwa talaga ako kasi naalala talaga nila Sir Marco lahat ng mga tinuro ko sa kanila. Alright? This is the site of CD4 positive lymphocyte maturation. Medyo nagkakagulo yung mga tao dito, ha. Sino yung sumagot ng adrenal gland? Yung nag-iisang sumagot ng adrenal gland. Sasakalin ko yon. Okay? Yung nag-iisang sumagot ng adrenal gland, sasakalin ko. Kulamin ko yon. Okay? CD4 is helper T CD4 positive lymphocytes are helper T cells. They are found in the thymus. Okay? Inechos ko lang kayo ng CD4 positive. Kayo naman. Okay? Helper T cells yun. Which of the following is important in normal DNA synthesis? Pinaltan ko lang yung pangalan ng vitamin B12, naloka na kayo. Cyanocobalamin, ilang beses kung tinanong-tanong yun kay Sino ba yung tinanong-tanong ko na yan? Si Krisha. Si Krisha ba yun? Hindi ko maalala. Or si Lilzo. Okay? Vitamin B12. Okay? Pyridoxal is B6. Okay? Related to this one, lack of this chemical will result to macrocytosis. Okay? Kasi nga, pag wala kang B12, ano mangyayari sa'yo? Maglalakihan yung mga cells mo. Macrocytic hypochromic anemia. What type of anemia would result from vitamin B6 deficiency? Sideroblastic anemia. Okay? Number 40. Madami pa rin nagkamali. Bakit iron deficiency lagi ang sinasagot ng mga students? Ano bang problema ninyo sa vitamin B6? Kayo ha? Kayo ha? Naloloka ako sa inyo ha? Anong problema ninyo sa vitamin B6? Ayan. Next. All of the following are true statements about HBH. I think everybody was able to answer this one correctly. I love it. All statements are correct. It causes hydrops fetalis. This, by the way, is known as Bart's hemoglobin. Lagi lang natin ganyan. Bart's hemoglobin. Abnormality in all alpha chains. It could be the beta chains on all four beta chains. Okay? Could be either or, alpha or beta. It has a higher affinity to oxygen. Yes, all of the statements are correct. So that is the correct answer. Let's see how many people were able to answer that one correctly also. Very good. A lot of people were able to answer that one correctly. Next, let's move on. Malapit na ba tayo? Nako. Kayang-kaya yan. Kayang-kaya yan, pasadahan. Alright. 42. 41 pala. 42 na tayo. 42. Which of the following is the function of vitamin B12 in GIT? Binds to methylcobalamin, binds to the intrinsic factor. Let's see how many people were able to answer that one first para hindi natin. Okay. So, meron distribution. So, the correct answer is this one. Okay? So, what happens is that intrinsic factor binds to the free methyl group to form methylcobalamin. So, cyanocobalamin nga siya, di ba? It becomes methylcobalamin kapag ka nadikit yung methyl group. Okay? So, it doesn't bind to methylcobalamin and to form homocysteine. That's in the last stages. Okay? It's free radical. Nope. Nothing. Choose ko lang itong dalawa na to. Methylmalonic acid is used to detect methylmalonic acid and homocysteine is the methodology. Okay? Which of the following is not expected from stem cells? Hyperproliferation, differentiation, apoptosis, or regeneration. There are two fates, by the way. It can regenerate or differentiate, or it could die. Three fates, rather, or it could die. So therefore, hyperproliferation means that there is what you call a malignancy. Okay? This is malignancy. Next. Which of the following molecules is present on the surface of unstimulated stem cells, which function as a receptor for hematopoietic stem cells for stem cell factors like the KIT ligand. So it's c-KIT molecule. Kaya nga meron tayong kinatawag na KIT ligand, 'di ba? Huwag niyo kakalimutan 'yan. And I think everybody was able to answer that one correctly. Let's see. 44. Yep. A lot of people were able to answer that. 26 people actually. 40% lang. Medyo disappointed ako doon. Alright, 45. Ito, lagi ko sinasabi sa inyo. Interleukin 3. So, hindi ko na kailangan i-explain. I think you guys already know. Which of the following cells are predominant in the yellow marrow? 46 people answered. A lot of them answered yes, this one. adipocytes. So no need to discuss that one a little bit more. Earliest hematopoietic activity is in the embryonic yolk sac. That is correct. Yolk sac. Which RBC inclusion is the oh my gosh, wag niyo kakalimutan si Jollibee ah. Okay. Wag niyo nakakalimutan si Jollibee. Ayan na 'yon, letter A. Kung sabihin meron pa rin nagkamali. Meron pa rin namili ng James Dots. Nakakaloka kayo ha. Wawarlahin ko talaga kayo. Ano yung James Dots na yan? James Dots is for what? Or Plasmodium ovale. Okay? Metachromatic granules. Ano may metachromatic granules na yan? Retics lang yan. Kayo talaga clasinetius lang kayo. Alright. Which of the following conditions are confirmed by trap stain? This is hair cell leukemia. Let's see how many people were able to answer. Medyo distributed ang disappointed ako sa inyo, nakalimutan niyo na antarctic resistant acid phosphatase. Burkitt's lymphoma cannot be stained. Diguglemus syndrome can be stained by myeloperoxidase. Fanconi anemia nga siya, so bakit kailangan mo siyang i-stain? Tingnan mo lang siya sa RBC. Tingnan mo lang yung RBC count ng pasyente, makikita mo walang laman. Okay? Next, RBC index that measures the degree of anisocytosis. Ito yung mga common questions sa board exam. So I wanted to see if the students were able to answer. Disappointed, 36% lang ang nakasagot. Correct answer is letter A, RDW. This is size, hemoglobin content, and hemoglobin content also. Okay? So dito makukuha yung macro versus micro. This one is normochromic versus hypochromic. Kailangan ninyo para meron kayong mga shortcuts. Okay. Next, which of the following traditional tests is used for the diagnosis of hereditary spherocytosis? I think a lot of people were able to answer osmotic fragility test. 51, yes. Very good. So there's no need for me to explain that. You guys already know. Next, which of the following, based on the following question, choose the best description for RBCs with this kind of disorder. So what do we look for? Spherocytes without a central pallor. Let's see how many people were able to answer that one. 52. Medyo distributed. Majority of the people answered. Sir Marco, meron akong concern sa number 52, but because everybody answered 37, which is correct because there's no central pallor, but majority of them are wrong. I don't know why. Anyways, you guys are correct. 52. Correct answer ng mo. Oo, ang correct 2/3. Hi, without may 51 is C.
So spherocytosis, letter A kasi mas maliit yung central pallor.
Akala ko walang central pallor. Alright. Baka magkagulo ang mga estudyante. Mamaya na natin pag-usapan yan. Yeah. I read it na ako. Sinearch ko na. Oo. Yep. So it's letter A. Thank you, Sir Marco. Never mind. Let's carry on. Okay.
Ganun ba yung pagkakaintindi nyo?
Okay. Ako din actually eh. Oopsie.
Pagkakaintindi ko kasi is 2/3 ng original size.
Oo. Central pallor ang tinatanong. Without a central pallor. Kasi wala central.
Central pallor kasi yung may refer. Yung 2/3 yung central pallor.
Oo.
Central pallor itself is 1/3 ng RBC.
Yeah.
Is meant is 2/3 siya from its original size.
Yep. Alright. Never mind. Tama pala si Sir Marco. Yep. Ako ang... Tama ka. Nabigla lang ako na. Kasi paspasan tayo eh. Anyways, let's continue na.
Kasi hindi naman na applicable si B, C, and D.
Oo. Hindi, 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 hindi. Ch- Children, let's move on. We'll ask Sir Marco about that later. Let's move on. My goodness. I have a class later. Let's move on to the next one. Saksakin niyo si Sir Marco dyan, wag ako. Anyways, let's continue. Hello, ito na naman. Meron na naman tayo mga disputes. Sir Marco, ano ba yan? The presence of bite cells na tayo. The presence of bite cells in the peripheral blood may be an indication of... Hindi ka nakamute, Sir Marco. Medyo nag-e-echo. Mamaya natin i-dispute. Chill lang kayo. Mamaya natin i-dispute. Kasi ako ano din ako eh. Oo. Oo. Next week. Oo. Oh, chill. Chill na lang tayo ha. Chill na tayo ha. Chill lang tayo. Okay? Isang item lang yan. Kung babagsak ka talaga. Alright. Nagagalit yung mga students, oh. Taray, yung biglang nagisingan ng buhay, oh. Kala nila may bonus yan, oh. Anyways, let's continue. The presence of bite cells in the peripheral blood may be an indication of um bite cells. There's precipitated RBC in the surface. Kasi nga 'di ba Howell Jolly bodies, they're considered precipitated DNA. They're precipitated DNA and they get culled CULL by the spleen. So I think a lot of people were able to answer that one correctly. Nope. Not many people answered that one correctly also. Okay, mamaya ka na mag-raise ng hand, Patrick. Jose Patrick, chill ka lang dyan. Bakit ba nagre-raise ng hand? Silent ba ako or what? Mamaya ka na, Patrick. Okay? In the previous question, spleen ulit yan. Okay? So, everybody knows that. I think everybody was able to answer that one correctly. Number 55, letter B is culling. Alright, so I mentioned that one earlier. That's the chemotaxis is not related, bridging is not related, coagulation is not related to that one. Which of the following statement is true regarding hemolytic anemias? MCB of patients is within normal range in most cases. There is no effect in unconjugated bilirubin. I think this was a repeat question. This is which of the following is true again? So this is 1, 2, and 3 again. Letter C. So a lot of people were able to answer that one. I'm surprised because the first time that question was asked, not a lot of people were able to answer that one correctly. So next is number 57. Number 57 is patients with hemolytic anemia would not be able to live normal lives. That is false. That is false. Depends on the mechanism involved on the hemolytic type of anemia. Okay? Depends kung anong klaseng hemolytic type of hemolytic anemia siya. Kung kung hemolytic disease of newborn yan, that person will not be able to survive. But if it is one of the other ones that we've discussed, person could live normal life. Sometimes the onsets will not be seen unless it's late, later in life, like cold hemolytic anemia. Okay? Next, why can't indirect Coombs test be used in the diagnosis of hemolytic anemia? Number 58. How many people were able to answer? No. A lot of people answered D. All of the above. No. The correct answer is letter C. HG detects surface-bound antibodies that can only be detected by the direct version of the test. Okay? Coombs test. Okay? Direct Coombs test. You can't use the indirect one because you're measuring the ones present in the serum. Surface-bound antibodies are the ones that you detect using with your direct AHG. Therefore, because most autoimmune hemolytic anemias are detected with DAT. Okay? Now, which of the following is the principle of sickle solubility screen? I think this was already discussed vaguely earlier. It helps determine the stability of RBCs in a acidic environment. That is sugar water test. Polymerization, this one. Okay, polymerization. So a lot of people were able to answer that one. Number 59 was able. Yeah, a lot of people were able to answer that one. We'll not deep into that one. Hemoglobin polymerization results 2. Polymerization results 2. Increase affinity to oxygen molecules, decrease affinity to oxygen molecules, sickling of cells, or hemolysis. That is sickling of cells. Drepanocytosis. Okay? Which of the following statement? So a lot of people were not able to answer that one, huh? So sickling of cells, polymerization. Okay? That's what happens when you have transposition of amino acids in your hemoglobin molecule. Which statement greatly affects the patient's ESR? The angle of the tube of the test, the temperature of the technologist, which is no. Yung temperature mo makaka-affect ba sa ano? Nope. Electrical fluctuations in the laboratory? No, it's a manual test. And sunlight? Nope. So it's the angle of the test tube at rest. Okay? Most common in all children, this is one of the things that we have in our PowerPoint presentation, FAB1. A lot of people were able to answer FAB1. Okay? 63. Which of the following is the preferred anticoagulant for coagulation studies? A lot of people were able to answer sodium citrate, which is correct. Okay? Which of the following, what is the disadvantage of using HPLC over hemoglobin electrophoresis? Is that it is not standardized, or quantitation is not standardized. 64. A lot of people were not able to answer that one. Most of you suggested that the sensitivity of hemoglobin variance is a known issue. Nope, it's not. It's actually the standardization, okay, of quantitation. Iron deposits can be demonstrated using what reagent? Pearl's Prussian blue na naman. Paulit-ulit lang yan si Pearl's Prussian blue. Which of the following tests is not congruent with the person suffering from iron deficiency anemia? Ito lang ang pag-iisipan ninyong dalawa class. Ito lang dalawang to. Okay? So, in a patient with iron deficiency anemia, the need for iron is intense. Therefore, the answer to number 66 is letter A, low TIBC. Okay? Next, platelet membrane disorder abnormality characterized by GP1B complex disorder, GP1 deficiency in GP1B for GP1B4 complex is Bernard-Solier syndrome, or Bernard-Solier syndrome, and if you want to be French. Okay? Anomaly seen here is platelet satellitosis or platelet satellitism. Next question is that how can that be corrected? You recollect the tubes in sodium citrate because the patient is inherently, or the platelets are inherently aggregating in EDTA. Okay? Next, identify the cell. A lot of people were able to answer that this is a basophil, but most of you, did you guys answer that is it for an allergic reaction? Yes, very good. At first glance, what would you see here? I see a lot of abnormalities. There is anisocytosis, but I saw drepanocytes around them, so therefore there is sickle cell anemia in this place. How would there be acute hemolytic anemia or autoimmune hemolytic anemia? No. I don't see anything. This is not normocytic, by the way. Is there pernicious anemia? I don't see any macrocytes. Is there blast cells there? Nope. So the case is sickle cell anemia. Okay, by the way, this is from Learn Heme Facebook group that I follow. What is the cause of the disease? We already know that this is a defective hemoglobin abnormality, sickle cell disease. Papasadahan na natin kasi alam naman na nila itong iba eh. Madami nakasagot ng tama. Okay? Number 74, which of the following tests can be done to classify the disorder? Hemoglobin electrophoresis for hemoglobin electrophoresis. What test can be used to manage the disorder? Taking hydroxyurea and consistent blood transfusions. Okay, hydroxyurea prevents the polymerization of red cells. Okay, it's very toxic to the human body. Okay, for 69-64, let's see what you look at, what you're seeing first. What technique was used here? There's only two things that you can say here. If you said right stain, you're already incorrect. If you said Giemsa stain, you're also incorrect. The correct answer is methylene blue. Okay, how many people were able to answer methylene blue? I'm disappointed. Okay. 28 people were on.
Sir, point of order lang.
Oh,
Ang daming nagsagot ng Prussian blue kasi nakita lang nila
blue. Nakakaloka kayo. Prussian blue, di ba sinabi ko sa inyo sa bone marrow lang, may nakikita ba kayo mga bone fragments dyan? Kayo talaga class ha?
oo nga.
So, kayo talaga
Nakita
class.
lang ng
Nakakaloka kayo ha. Dahil blue daw. Methylene blue gamit din doon sa kabila. Nakakaloka kayo. Sasakali ko kayo ha. Which of the following tests would be used to would be best used to use this stain? It's for what? For hemolytic anemias. Okay, that's the correct answer. Tama ba 77? Madami nagkamali kasi akala nila hemosiderosis daw. Okay, how many reagents is needed to achieve this? There's only one reagent because it's a supravital stain. Kailangan nyo idagdag immediately. Okay? Is the finding abnormal? Yes. If yes, why? No, it's a normal finding. Yes, it's a normal finding because there's a lot of hemosiderosis. No, there is a lot of reticulocytes, class. Class ha, tandaan, ganyan ang itsura ng reticulocytes. Ayan, oh, class, ang dami, oh. Diba? Alright. Refer to the question provided below. Normal control is this one. Positive control is this one. This was the exercise that the same exercise that I gave you guys. So we're not gonna tackle this one. You have a video for that one. But just in case class, I wanted to see how many of you were able to answer the question. So for 80, a lot of people were able to answer correctly. For 81, 82, wala na talaga. Okay, which of the following digests fibrin cloths? Ang sabi nila, sabi ng consensus is plasminogen daw. Letter B, plasmin ang ginagamit. Plasminogen is the inactive form. Plasmin is the active form. The correct answer is madaming sumagot ng plasminogen.
balik ako dun sa electrophoresis.
Oo, bakit? Ayan,
Yung
normal, 1, 2, 3, 4.
sample 1, meron siyang hemoglobin
It's
S.
time for bed.
Hmm. 'Di ba? Ano shortcut natin, class? Pag acid electrophoresis.
Alarm set for 1 p.m.
Ano ang shortcut natin, class? Oh.
Ano din? HBS yung tanong. Hindi, HBS trait. Pag HBS trait po kasi, isa lang. Pag HBS syndrome or disease, dalawa.
Hmm. Ano na naman ang kine-question? Nakakaloka talaga. Nakakaloka talaga kayo. 81? 81. Which has trait? Isa lang naman ang may trait dyan. Eh di sample 1. Oh. Bakit? Ano ba yung nasa number 4? 1, 2, 3, 4. Oh. Oo. O sige nang. Oo nga no. Oo nga no. Oo. Oo. Sige, go. Oh, bahala kayo dyan. Patayin niyo si Sir Marco. Sandali lang, matatapos na tayo. Ang daming kaguluhan sa end eh. Nakakaloka kayo ha. Kanina, tinatanong ko kayo, wala kayo nagre-react. Which of the following factors are involved in the common pathway? Factor 10 yan. Okay? Okay. Factor 10. Plasminogen. Sickle cell trait has the following alleles. Sickle cell trait has the following alleles. Nasaan na tayo? Person with hemophilia A has a deficiency in factor 8. Okay? A lot of people were able to answer that one correctly, so I don't need to discuss that any further. 86 tayo. What abnormality do you see here? Shijak Higashi? No, that is toxic granulation. And I think a lot of people were able to answer toxic granulation. So we don't need to worry about that. By the way, you just look at the blue dots there. That's not a vacuole. That's not Shijak Higashi granules because it's not dark. So it's automatically granules. If it's a Cabot's ring, you won't see it in a WBC. Okay? Condition associated with that is sepsis. Obviously, you're toxic because you have a lot of bacteria. Okay? Next, abnormality seen here is a helmet cell. Did a lot of people answer that one correctly? Yes, very good. Helmet cell. 88. What condition may be associated with this? Is it an artifact? Is it disseminated intravascular coagulation? Is it forceful smearing? Disseminated intravascular coagulation. What's in lead poisoning? Punctate basophilia, forceful smearing is smudge cells. Artifacts usually are usually your over burr cells or acanthocytes. Never would you see this in disseminated intravascular coagulation because you'd see it in you would never see those cells in the ones that I mentioned before, because it's these cells that you see, which is the hallmark of disseminated intravascular coagulation. All right, anticoagulant of choice for peripheral blood smear, it's still potassium EDTA class. Walang nabago class. Which of the following parasites is seen in blood smear? Wala naman tayo bihira lang tayo makakita ng amoeba. It's Plasmodium vivax. And binigyan na kayo ng clue, oh. Ayan, oh. Test taking skills. Pag alam niyo yung wala naman talaga yung dalawang yan, edi kunin niyo yung number C, di ba? Test taking skills yung daig ng wais ang matalino. Thick and thin smears are used for what? Demonstrating RBC anomalies, quantifying RBCs, demonstrating parasites. Yun lang ang tamang sagot. 92. Demonstrating parasites. You can't quantify RBCs in a thick smear or a thin smear. So that's the correct answer. Okay? Tingnan natin, may mga tumama ba dyan sa 92 na yun? Hoy! Bakit both A and C? Bubula talaga ang bunganga ko sa inyo. Bakit 43 people answered both A and C? Hoy! Makakadiverse. Kakaloka kayo talaga. Hoy, nagigigil ako sa inyo. A dry tap from bone marrow aspiration is usually indicated of what? Indicative of what? Myelofibrosis, mast cell leukemia, erythroblastosis fetalis, hydrops fetalis. X mo na itong mga to kasi sim lang silang dalawa. Okay? Mast cell leukemia, madami ang WBCs kasi nga may leukemia ka eh. So myelofibrosis ang tamang sagot kasi sinabi ko nga sa inyo, yung stem cells niyo ang ginagawa niya is hyperproliferation of fibrous tissue. Okay? Yeah, myelofibrosis with myeloid metaplasia. Okay? Next, Bart's hemoglobin naman tayo is designated as HbH. Okay? So madami naman na itama, sir, pero hindi lahat tama. Yun ang nalulungkot ako. 95 to 97 is for this cell. What is this cell? That is a flame cell. Okay? That's a flame cell. Tartrate resistant cell, usually brown siya. Mast cell, kasi ang gamit mo is trap stain. Reed-Sternberg cell is the owl one. Okay? Owl's eye. And mast cell is your basophil. So does this look like a basophil? No, it doesn't. It looks like a flame cell. Only 22 people were able to answer that one, which is something which is why I'm disappointed. 96, letter C ang tamang sagot. That is a hallmark of multiple myeloma because a flame cell is actually a plasma cell, which is your question in number 97. Okay? Hyperviscosity syndrome naman tayo. Which of the following is associated with hyperviscosity syndrome? Gawa-gawa ko lang si blue histocytosis. Huwag kayo maniwala dyan. Char lang yan. Burkitt's lymphoma, hindi kasama. Aplastic pneumonia, paano ka magkakaroon ng hyperviscosity? Wala ka nang dugo. Diba? So, multiple myeloma siya. Kasi abnormal hemoglobin. Itong flame cell na to, produce ng antibodies. Okay? Next. Last question na tayo. Last question na class. Huwag kayong ma-stress. Ito na last question na. Mamaya nyo saksakin si Sir Marco. Okay? Drepanocytes are usually seen in what cases? Sickle cell anemia. Inetchos ko lang kayo, pinaltan ko lang yung sickle cell into drepanocytes. Okay? Walang kinalaman ng Glanzmann thrombasthenia at saka ang Bernard-Solier. These are both what? Coagulation disorders. Hemolytic uremic syndrome is a hemolytic disease associated with is a hemolytic syndrome caused by E. coli. Okay? Happiness can be found. Last question. What important lesson have you learned from me? Obviously, yung ganda ay nasa loob. Okay? Charet. Mala kayo dyan. But my quote for the day is, although alam ko madaming nadidisappoint, isa na ako doon sa results ng exam ninyo, happiness can be found even in the darkest of times if one only remembers to turn on the light. Albus Dumbledore from Harry Potter. Thank you so much, and I think that's the end of our lecture. Ano na mga disputes? Bago ako umalis, may mga dispute.
Yung sinabi na lang, sir, yung 82.
Ano yung 82? Dali, balikan natin.
Hypoesis.
Aha. Oo nga, sir. Yeah. Oo. Kasi ano to, sir? Kasi itong isa pala, sir, nakalimutan ko. Pag binaba mo yan, nasaan na ba yan? Oo nga, nakita ko din kanina doon sa original ano ko. Pag binaba mo yan, nandun yung other ano nandun yung other hemoglobins. Oo. Yes, we have to accept. We have to accept that sometimes we make mistakes, 'di ba? Pero oo. Oo. Okay. So yun lang yung dispute natin. Wala na yung kanina pa yung isa. Nanahimik na sila dun sa isa.
Meron pa nagkamali sa 100 pala, by the way.
Sino nagkamali sa 100? Na, sasampalin ko talaga, Diyos ko.
Sabi ko sa kanila, pakishaded yung letter A para makount dun sa script.
Ay, naku, hindi talaga.
Letter E.
Ay, naku. Na ano ba yung pronunciation mo, Sir Marco?